All right, good morning, everybody. Very happy to be here. So I wasn't like half listening to Helen apparently. I don't know if she said the full name of our bureau, but it's the Bureau of Health Promotion and Risk Reduction. It's a little bit of a mouthful, but I'm very happy to be here today and to see so many of you working to advance oral health in Pennsylvania. I was able to be here yesterday as well and just really always enjoy this conference. I want to extend my gratitude to all of our oral health partners representing community organizations, health systems, state agencies, and beyond. Your commitment is really what helps us make progress possible. And together, we're not only addressing oral health, but we're also advancing health equity, quality of life, and opportunity for all of Pennsylvania. So, as you know, oral health impacts our ability to eat, speak, learn, and thrive. It's directly connected to chronic disease, maternal and child health, and overall well being. Most importantly, oral health is an area where prevention and collaboration can create lasting change. Today, we're going to talk about a high-level overview of where we are with the state. I'm going to highlight some of our ongoing projects and set the stage for our shared priorities as we move ahead. I invite you to keep in mind how each of these updates connects back to the shared mission of equity, access, and healthier communities across Pennsylvania. Next, I'm just going to set the stage a little bit where our oral health program lies. So within the Bureau, we have 4 divisions: nutrition and physical activity, cancer prevention and control, tobacco prevention and control, and then violence prevention, which is where our oral health program lands. I'll let you think about that for a little bit. I always say when I introduce the Division of Violence Prevention, I give a caveat that that division includes a lot of other programs, including oral health and then some cardiovascular and stroke programs. The division is led, I'm going to highlight some of my staff that are here, by Brian Wyant, who's here. Brian, do you want to give a little wave? And then the oral health program is led by Dr. McDaniel, and she was not able to be here today, but I'm sure most of you know Dr. McDaniel, and she gets all the credit for this presentation. I'm just the one who has to speak today, but really her and the team of our 2 administrators then are Jan Miller and Sarah Welch. I did see Jan earlier. I don't see her in the room right at the moment, but Jan is also here today. So what does our oral health program do? We promote oral health initiatives statewide. We increase access to care, support preventative services like sealant and fluoridation programs. We advance health education and strengthen our oral health workforce. We also monitor and evaluate oral health data to ensure we're making evidence-based decisions that drive real impact. And while we're talking about data, I want to acknowledge Dr. Yang. He is our epidemiologist. He is also in the room today. I like to give him a little shout out. He was not expecting that. But Dr. Yang and his colleague, Jennifer Burrows, they do the workforce reports each year for our dentists and our dental hygienists. So I'm sure you've seen that report. They're working on the 2025 data right now. So I want to give them a little shout out as well. So here in oral health in Pennsylvania reflects the progress we have made and some challenges that still are kind of standing in the way of equity for all. We know that oral health is directly tied to overall health, yet too many people, I think as we all heard yesterday, still face barriers that prevent them from accessing the care they need. So kind of our current condition. Across the state, oral health outcomes are improving, but they remain inconsistent and closely linked to geography, income, and social conditions. As we heard yesterday, people in the urban areas tend to have more providers, stronger public health infrastructure, and easier access to preventative services. In contrast, many of those in our rural communities experience workforce shortages, limited transportation options, and fewer school-based or community-based programs. We also heard, I feel like I'm just repeating yesterday, that our Medicaid provides critical coverage, but there's low provider participation and limited adult benefits, which limits access. We have preventative strategies like school sealant programs and community water fluoridation are some of the most effective tools we have, but their reach varies widely. And just yesterday I was talking to somebody at my table and they said, oh, you live in a suburban area, your water must be fluoridated. My water is not fluoridated. I live like 10 minutes away from here. I thought I lived on well water my whole life. I thought, oh, I moved to this development, I'm on public water, it's going to be fluoridated. It is not. So that was a little disappointing. So, as we know, the social determinants of health continue to shape outcomes with low-income families, racial and ethnic minorities, older adults, and people with disabilities facing higher rates of untreated tooth decay and gum disease. These disparities mirror broader health inequities and point to the need for solutions that integrate oral health into the larger health system. So next I'm just going to highlight some of our key challenges, and again, a little bit of preaching to the choir here, but workforce shortages are one of the most significant barriers to progress. Many dentists are nearing retirement, and too few new providers are entering the field to replace them, especially in rural and underserved areas. Dental hygienists and expanded function dental assistants are critical to expanding care, but recruitment, training, and retention still remains difficult. Infrastructure and policy barriers also continue to limit our impact. Communities often lack the resources to launch or sustain school-based oral health programs. Water fluoridation efforts have stalled in some regions, and in others have been rolled back due to political resistance. Low Medicaid reimbursement rates also discourage provider participation, and current payment structures often fail to support prevention-focused care models. Next, I'm just going to touch briefly on our oral health plan. Our plan goes from 2020 to 2030. So we did a 10-year plan. And so the kind of plan is our roadmap. It's created with a lot of stakeholder input. We have an advisory group that I know many of you are a part of because I've been at those meetings, I've seen you at those meetings. But our overarching goal is to enhance overall health by improving oral health. And the plan is really anchored in three priorities: expanding access and prevention, strengthening our oral health workforce, and building a sustainable infrastructure. We kind of structured the plan in two phases. So the early work focuses on systems and surveillance, while the later years of the plan are focusing on equity, policy, and community engagement. But most importantly about the plan is that it really engages a wide network of stakeholders, from policymakers and providers to schools, funders, and community groups. Next, I'm just going to touch on some of our funding sources and our ongoing projects. The first up is our grant from the CDC, and that grant is called the State Promotion of Strategies to Advance Oral Health. And we received this fall our year 2 notice of award. It's a 3-year project, so we anticipate having that funding through 2027, and that annual award is around $380,000. The project focuses on reducing disparities and improving access through evidence-based public health strategies such as expanding fluoridated water, preventative dental services such as fluoride varnish, and infection control compliance. It also enhances data systems to strengthen the public health practice and supports the integration of medical and dental services for adults with type 2 diabetes. Our second funding stream comes from HRSA, and that is a grant to states to support the oral health workforce activities, and we are in the final year of that grant. It goes through August of 2026, and that funding is around $400,000. So I'd like to point that out because we are doing a lot of work for not a whole lot of money, and that's really in thanks to all of our partners and the stakeholders that we work with each day. The workforce grant supports state-level innovation to expand oral health services in dental health professional shortage areas, improve evaluation and program performance, and promote the sustainability of workforce initiatives that enhance the quality of care. The last funding source comes from the Preventative Health and Health Services Block Grant. This is a block grant that funds a lot of different programs within our Bureau, but some of that money we do also support the oral health program with, and those funds help with the school sealant program and help fund the oral health plan advisory group. And those efforts are really essential for maintaining prevention-focused programming and the coordination of our oral health partners. And so here is a QR code. Again, you'll get the slides, but that takes you right to our oral health program site. And I just really want to take a minute to thank everyone for their continued partnership and the dedication to advancing oral health across Pennsylvania. Our shared mission really remains clear to ensure that every Pennsylvanian has the opportunity with good oral and overall health. And with the support from our federal funding and our key partners, including PCOH, who we work very closely with, we are building stronger systems. We're expanding our reach and making measurable impact. And I just want to thank everyone again for your commitment and collaboration as we move this important work forward. Thank you.